Okay.
Hello, everyone. Welcome to Brainwaves. Thank you all for watching and participating today. My name is Brandon Stagel, and I'm your host. Today on Brainwaves, I feature two of my friends, two great brain health advocates, Robin Cunningham and Hakon Heimer. In 2012, these two have started a nonprofit called Cure Alliance for Mental Illness, which focuses on building public support for brain health research across the country. These two have graciously agreed to appear with us on Brainwave today. I'm going to ask them some questions, and we'll hear their insights on where our society is in the search for cures for brain health conditions and what we can all do together to help get us there faster. Now, to you watching today, you're welcome to post your own questions for Robin and or Hakon on the Google Hangout during using the Q&A app. It's a little icon below the screen, below the window. I'm going to start with the questions. And Robin, Hakon, I want to thank you both for appearing today. Robin, thanks for appearing.
Thank you. It's a pleasure to be here.
And Hakon, thank you for being with us today.
Thanks for inviting us and for all your great work.
You're welcome. Yeah, thank you both for your work too. I think it's awesome what you guys are doing. So I'll start by asking you each a little bit about your background. Robin, what is the source of your interest in brain health research advocacy?
Well, it began actually many years ago. I became ill with schizophrenia when I was 13, and I knew none of my family history. But as it turns out, it is endemic in my family. My grandfather had it. My uncle and aunt had it. My father escaped, but I developed it at 13 and have been dealing with the illness ever since that time. So I have a continuing interest, and probably will the rest of my life.
Okay, so that makes sense that you'd be interested in brain health research advocacy then, having had schizophrenia. That's kind of how I got into it myself. And Hakon, how about you? What's your background and your interest in brain health research advocacy?
Well, the interest, like I think with all of us, there starts with something personal and selfish in a way, is that you or someone in your family gets sick. And for me, it was my younger brother, Gösta, who's 5 years younger than me. When he was 16, he had for us, a very dramatic psychotic break. And I was in college, so I obviously wasn't quite around as much, but no one in my family really had noticed anything, and he reported later he heard some voices. But all of a sudden, one evening, my girlfriend and I were out at dinner, and no one else was home, and we got a call from my youngest brother who said, Gösta's upstairs breaking windows and saying that Conan the Barbarian is talking to him through the television, and it was a shocking thing, and so that was what got my family interested. My parents got very involved in NAMI very early on, and almost soon after NAMI had started. So that's the personal part of the story, and then that led me to I was an English major, and I decided, well, I'll just become a scientist and cure schizophrenia. How hard could that be? Being the typical English major, I thought science can't be that hard. And so I went to graduate school in neuroscience, and discovered along the way that I actually wasn't a neuroscientist. I was an English major impersonating a neuroscientist, I always say. But what that did was it led me into a career in science editing, and eventually into working on the web with one of the original knowledge environments for disease information for scientists. And that I eventually I replicated that for schizophrenia. So that's still my main work, is a project that I do through the Brain and Behavior Research Foundation called Schizophrenia Research Forum. And that, in turn, led me to organizing conferences at the Banbury Center at Cold Spring Harbor Laboratory on mental illness and neuroscience. And so I try to find interesting topics for small workshop retreat meetings. And that, I guess, in a sense, is how I got to working with Robin, because when we had a meeting a few years ago about the lack of advocacy for very specifically the NIH budget and mental illness research within it. There are some very well-organized groups. Everyone knows about the cancer groups, and autism recently, in a sense, has kind of set the example for us in the mental illness community of how do you go to Washington and advocate. And around that time I met Robin, and I guess Robin, you had already been doing some work with NAMI, but you were interested in research.
Yeah, I was very much so. It was interesting how we met because I was also on the board of NAMI New Jersey and the Governor's Council on Mental Health Stigma at the time, and the board of a treatment agency. And I was just interested in doing a lot more. It was funny. When I was a child and I got the illness, it was, of course, very traumatic. It took about 10 years before I really got stabilized. It was a very, very difficult time, all through high school and college and even into graduate school. But I thought my job at that point, back in those days, was to, once I got fully functioning, I thought my job was to go out and have a life. So I did, and I got my MBA, and I went on in business, and had a pretty successful business career. I worked on Wall Street. I did some venture capital work. Started the bunch of companies. We bought and sold companies for our own account, things like that. So my basic training in organizing things was from a profit point of view. So I decided to approach this whole thing from a profit point of view. And Hakon and I bumped into each other after, I think I talked to somebody at Harvard about it, and we connected. But we were juggling for how do we want to do this. Hakon won. We decided to do it on a nonprofit basis, which it turns out I think makes an awful lot more sense, at least at this juncture. But it's how the opposite sides can go.
Yeah, and I'm impressed with how far Cure Alliance has come. Well, you guys can tell us a little bit more about that and your insights on the issues that it advocates for. So first I want to ask both of you, why is funding for brain health research such an important catalyst for improving patients' lives in the near future?
Well, one, there's the issue there's the issue of treatment, for one. You're talking about the short term. In the short term, the issue of treatment is a big issue. It's not clear at this point what is going to turn out in the end to be best practice treatment. There's a lot of work being done. There's work that's been done in Australia. There's work being done in England. There's a lot of work done here. An example of a program that is in fact sponsored by the National Institute of Mental Health is the RAISE program, which was conducted by John Kane. And it was investigating, like they did about 10 years earlier in Australia, it was investigating what would be the effect of taking a specific treatment regimen and getting people with their first evidence of psychotic break and give them intensive treatment using that particular regimen. I remember he asked me once, or I commented, maybe he didn't ask me. He said he didn't know what the results were going to be. And having lived through it, I said, well, I can tell you what the results are going to be. It's going to be a watershed, because I think what you're doing is very, very significant and very forward-looking. So, in the short term, I think those kinds of things. Hakon, you have more of the scientific point of view on this.
Well, even on the short term, you know, there are a lot of things in the services and current treatments arena where there's just a lot of research that still needs to be done. So the RAISE study has actually is completed already, and the results were reported at the NIMH Council meeting I guess it was in January. And I'm actually a member of NIMH Council, so I got to hear the sneak preview before it was published. And there were definitely some improvements on several different domains. But the thing, of course, is that they were limited to a little bit by saying we're going to provide people with what's easily accessible through current insurance reimbursements, things like that. And of course, what we'd like to see is, what if we took the absolute best practices that could be offered in different places and applied those? And then, of course, we'd like to know, can you improve on them? And so it's actually very interesting. NIMH is planning to put together a network of first episode clinics, and first episode clinics are just mushrooming around the country, which is a great thing. I think there somewhere there were only maybe a dozen or 16 of them in the past year, before the past year. Now by the October of this year, there are supposed to be somewhere in the 30 or 40 range, and there's supposed to be over 100 by the end of 2016, and this is thanks to funding from SAMHSA. And they're going to be, some of them are going to be tied into a network where they'll be able to do research on what's actually working in different clinics. And I think that's the kind of thing that when we call for research funding, we have to really push hard that a program like that gets funded adequately.
Definitely. I think it's an amazing, so far, the results they've achieved so far with the RACE program are extremely encouraging. And a family that I also work to encourage the development of more early psychosis intervention centers as well. So I'm all for that too. It's clear that brain health research can help patients in the near term if funding is available for it. What about for our society? Why is brain health research and funding for it so important for our society's future?
That's a very good question, because you're talking about more into the distant future. And Hakon can probably speak to this better than I am, because he's not only on the NIMH Council, he represents that council to the Council of Councils at the NIH. So he gets a very broad view of all these things, and a detailed view, I might add. But I think the ultimate solution to all these things is going to take longer, and it's going to involve a lot of different kinds of research. People often talk about genetics, and genetics isn't neurology, but all of this is tied together, at least in my mind. The old issue in psychology, when I went to graduate school at UNC in psychology, was the question was it nature or nurture? And I think one of the things we've discovered over recent years is that it's both. In fact, it's a lot of both. And to get those two wed together is I think, essential to working out the long-term solutions. The RDoc program at NIMH, I think, in my mind, again, is something that's very forward-looking, because it talks about trying to make all the connections between genetics, brain circuitry, developmental aspects of the brain and the central nervous system, environmental effects, effects of memory, and all that sort of thing. But again, Hakon's really the expert on this. Go ahead, Hakon.
I was just going to say that the other way to look at this, from the point of view of society, is the burden of the diseases. And in the last 12 years, I guess, we've really had the first ever large-scale burden of disease studies that attempted to really tell us what are the burdens of different diseases on society. And they don't just look at how many people have the disorder. They look at what age do you first get the disorder. So you can make some sort of comparison between the burden of autism, let's say, which you get at a very early age, and for many people with autism, you're disabled for life. Versus a disorder that, we all of us worry, I suppose, that we're going to get Alzheimer's or dementia of some sort when we get older. But you can't necessarily say that one case of Alzheimer's equals one case of autism in the long run. I mean, I hope that there'll be lots of research on Alzheimer's, so that if I get it, that my later life will be a better one. But autism is a bigger burden overall, and so those studies have come out in the last couple of years, and they've shown that mental illnesses have a huge burden on the individual. And I think that's the important thing: is what's the burden to the individual, not what's the economic cost to our society. I'm always a little annoyed by these cost to society analyses, because I think that the most important thing is what's the burden of that illness on a person. And so I think that that's one of the really big things, is that the burden of the mental illnesses are pretty comparable to the cancers, really. And cancer is something we put a lot of attention on. And and here an example of what we can really do when we put money and research into things is AIDS. AIDS went from being a death sentence 15 years ago or 20 years ago to now it's a chronic manageable disease. And I think that's people always criticize those of us who call for research, saying you can't just throw money at the problem. Well, I'd say that we've thrown money at AIDS, and guess what? We haven't cured it, but and this is sort of a word that a question we come up to sometimes is, what do you mean by the word cure? Well, we really just mean anything that makes people able to live their lives in a more or less normal way, and I think we could do the same for mental illness if we were willing to invest in it. And I just say one more thing, and not to talk too long, but for me, there's a personal perspective too, which is that schizophrenia, autism seem to be many different disorders. So people have many different outcomes. And my brother's at the kind of the opposite end of the spectrum in schizophrenia, where despite getting some of the best care, maybe not the best care that he could have gotten, he's at that third of someone who's very disabled, who doesn't work, and it's affected his life in major ways. And so I think that while we need to think about how do we maximize what we have now using research, there are people who aren't going to be helped. I think there's going to be a spectrum, and those people, I think their best hope is in all the basic science research on understanding the brain, and then the more sort of, I guess you'd say, the more intermediate research, translational research of understanding mental illness through genetics and neuroscience.
I can speak to the personal cost. The personal cost is enormous. It has been in my case. I've been fortunate in the sense that my illness has been episodic. I've had 3 major relapses, well, counting my original illness. But in times between that, I was highly functional. And I've been lucky in that respect. There have been periods where I've been highly functional and able to do a lot of things, but there have been periods when I've been terribly dysfunctional. Some people are nailed from the very beginning, and it's very difficult for them to get along in life. All these people have to be taken care of. I do think, however, being the businessman and the history that I have, I do think that the economics is important, because I think it costs our society a great deal more, especially in the long run. It will cost us a great deal more, especially in the long run, if we ignore these illnesses and don't spend the money involved. It's a matter of an investment from my perspective. If we invest in this research, we're going to have a lot more people that are going to be functional and a lot less people that are going to be dysfunctional in the long term, and it's going to cost society a hell of a lot less.
Well said. Thank you, Robin. On that note, what level of investment do you think will be necessary by the federal government to achieve significant progress toward better treatments and possibly cures in the near to medium term? And how does that compare, do you think, with the level of funding right now? How much do you think it needs to increase?
I defer to Hakon on that one.
What we need is a question that's harder to answer than what we could do. So if we base the funding on the burden of disease levels, then the National Institute of Mental Health, whose budget now is about $1 billion, would have a budget of about $4 billion. So in 2015, as I said, the NIMH budget was about $1 billion. It's actually more about 1.3, but about 300 million of that is AIDS research that's spread around the different institutes. But we spend $3 billion still on AIDS research, and AIDS has, in the United States, has dropped to a fraction of what it used to be. It's still a global problem, but that's more of a services delivery problem in third world countries and a prevention problem. But I think, what if we doubled the NIMH budget? That's a simple kind of a thing to call for that I think would allow us to do a lot more genetics. I think genetics I don't think they're the be-all and end-all, but I think that we could get a lot of good clues from genetics. I mean, that's really the thing about science, is you don't want to put your money on any one horse. You have to understand that you might get insights from unexpected places, but you have to look in all the expected places as well. And so, for example, the National Cancer Institute has a cancer genome atlas. It's a very big project for genomics. You know, imagine if we could apply all the best tools of genomics to mental illness. I bet we could make some really great advances. And then we could also put money into all the other areas that are obviously going to be helpful. Behavioral research, psychopharmacology, basic neuroscience.
Yeah, and speaking to the genetics angle, once scientists can understand what genes are involved and how they work, then perhaps they can target new molecular therapies at those mechanisms that come out of those gene activities, just so people can understand better. But yeah, I agree with you on all those counts.
My experience is purely anecdotal, but purely anecdotal, but it's schizophrenia runs in my family, and it's pretty clear to me that genetics is involved in this somehow.
Definitely, yeah.
My mother was not a schizophrenogenic mother.
No.
Very kind and considerate mother, and she was very, very concerned about me. She didn't always do the right thing, but she and my psychiatrist argued quite often. But she was very concerned, and my psychiatrist let me to understand that, which was part of my recovery.
That's excellent. Yeah, family is so important to have support for your family for somebody's recovery. And I'm glad you did too. Yeah. So beyond getting more funding for research as a means to increase the pace of treatment development, what other changes could take place in our society to improve life for people with mental illness?
People need to wake up. They need to wake up and realize that a great proportion of our society at one point in their life or another, and sometimes multiple times, suffer from one of these illnesses. And the burden rates that Hakon was talking about are enormous. They need to wake up, because we need to do something, or this is just going to get worse and worse and worse, and it's going to be a drag on our society. From the business point of view, again, it is a terrible weight, a terrible drag, and we have to deal with it. If we don't, I don't know what's going to happen if we don't. I think it's a very serious issue, and I think it needs to be addressed. I think that people need to get involved in one way or another, even if they're not immediately involved with an illness themselves. Chances are pretty good one of their friends or their relatives is, or is or are, whatever. But someone they know, or someone in their family, or is involved, even if they're not, and they need to pay attention to this. And they need to do whatever they can on a local and a national scale to influence public opinion, to influence our Congress and whatnot. And this is a keystone to part of Cure Alliance's strategy that Hakon developed. He developed, I think, a very good model for our involvement in that effort, and I'll let him talk to that, because he's the one that thought it up. But I think it's very good. That's part of the reason we got on board together.
Yeah, I mean, I'm not sure exactly what you're referring to, but I think that what I was going to say, and maybe this is part of it, is that there are so many people right now doing interesting things. There's this real zeitgeist in the mental illness advocacy community that wasn't there even 5 or 6 years ago. You know, there was, in a sense, there were a couple of stalwarts. There was NAMI, who was holding down the fort, and MHA in terms of advocacy in Washington. Brain and Behavior Research Foundation was funding some research, and I think IMRO hadn't quite started up yet. But you know, then just in recent years, you know, IMRO and One Mind trying to create a wide brain-based research effort. Glenn Close and Bring Change to Mind working in stigma, and I think that all of these things help each other. They can help each other. I think that's. I hope that we can, as we mature as an advocacy community, we can actually come together and work on things that interest us and pick topics that we don't have disagreement about. And you know, so I think that reducing stigma will make it more easy for us for what we want to do, which is increase the federal budget for research, not just NIMH, but any governmental agency that doing some sort of research. Centers for Disease Control does a little bit. SAMHSA doesn't really do research, but they do surveys, and they need more money too. Then I think conversely, I think that if we're able to find more effective treatments, every time a new treatment comes online, that reduces stigma in turn. So I think that all of these efforts can work together, and then of course all of those things will help the people who are doing services advocacy. If we can show that we have better treatments, then I think it'll be more likely that people will get legislators to say, yes, we'll pay for people to get full parity treatment.
Michelle Obama has gotten involved in this through the Given Our organization and the initiative they have going called Change Direction. That's run by Barbara Van Dalen. She's wrapped this around vets, and I think the situation with our vets and the difficulties that they have has helped to call some attention to that, because it's also quite severe. But they suffer from like everybody else. They're susceptible to mental illnesses in the first place, and oftentimes they have an added burden. So
I forgot to mention Patrick Kennedy too. I mean, he's sort of like he's our godfather. I'm not sure what the correct the correct would be, but he's the sort of he's our guiding light.
Thanks for mentioning Patrick. He's a wonderful guy, and we at Emerald are proud to work with him too. So how can people in general, viewers who are watching today, for example, how can people get more involved in advocating for brain health research and following Patrick and your footsteps?
Well, there's a ton of ways. There's about as many ways as you can count. There's the whole online community. There's local activities with various organizations. There's opportunities to sign petitions, to go to Congress. There's just about every way you can imagine, and we all like to do different kinds of things. Some people like to be online. I'm still trying to get comfortable with that, being the old guy that I am, but I'm learning slowly. Hakon's been teaching me. And there's just a ton of ways to do this, and I think somebody just has to have the presence of mind to decide they really want to do something about this and figure out which way that they enjoy participating in the effort the most. I think it's simple as that, but it takes a conscious decision.
And the other way to think about how there are many different ways to do it is that the organizations that I just mentioned do different things. And if what you really like is researchers and you really want to be up close and personal, then IMRO or Brain and Behavior Research Foundation, those organizations that are actively supporting research. And if you really like public engagement, then Bring Change to Mind is a great place to get involved. And if you want to work on the services and getting the best services, I think that's probably still NAMI and MHA's forte. And then our forte is I think an area that some people are shy away from a little bit. It's the getting in there in Washington and fighting for your slice of the pie. And it's a little bit like if you go to court, you have to have a lawyer. Most people who defend themselves don't do so well, and I think that what we're hoping to do is to eventually, convene as many of us in the community as possible to talk about the research pie. And I think you can, if you want to work with us, I think you can leverage your time and money a lot with Cure Lines, because if we could double the NIMH budget, it's a big goal, but I think it's something that's worth aiming for. Then you could take $1 billion and turn it into $2 billion, and then instead of having all the scientists fighting with each other about who's getting the right amount of money, there'd be enough money so that the imagers would have money for their imaging, and the geneticists could do their genetic studies, and the neurobiologists could do their neurobiology, and the services researchers could evaluate all the different services.
And collaboration would be easier then too, because as you said, scientists wouldn't be so inclined to worry about whether they would get their own funding and try and be the lead author on their papers. Rather, they'd perhaps be more open to team building and team science, which is going to be crucial for accelerating research by uniting larger data sets and uniting the resources and talents of different scientists. to share their insights and build more insight in kind of a synergistic way. So I'm all for the increased funding for the federal budget as well.
I remember a friend of mine was chairman of the board of a major corporation, and he couldn't really do anything. I asked him once, "What do you do?" And to make a long story short, he thought about it for a while, and they basically said, "Well, I try to keep everybody I hire the best people I can, and I try to keep everybody in the same boat, rowing in the same direction, and that's my job. I can't go out because we got salesmen. I can't go out and buy anything because we got purchasers." He said, "But that's my objective," and in a sense, that's I think what Patrick tried to do, and we need that. It's desperately needed. We cannot forget about the long term or the short term. They're both extremely important. If we forget about one in favor of the other, we're selling ourselves short, and I think that's where Cure Alliance comes in. It is, as far as I know, the only advocacy organization that focuses specifically on scientific research in mental illnesses. And if you're got a family member, or you yourself have a mental illness, or you've got a friend, if you want to get involved in the now and the future of finding solutions for these brain disorders, I think Cure Alliance is the place you want to go. I'm putting in a plug here. I hope you're that.
That's great, Robin. Robin, what is the URL for the website for Cure Alliance?
URL, www.curealliance, that's CUREALLIANCE, I'm a lousy speller, .org.
That's it. Thank you. So thank you both for appearing today on Brainwaves. And if viewers, thank you for watching. So Robin and Hakon, if viewers have any questions for you following up after this broadcast is over, on the Brainwaves page on IMRO's website at imro.org/brainwave/brain-waves, the link will be on the link is on this Hangout on the right. You can see it there, viewers. Then are you ready to answer some more questions over the next few days?
Absolutely.
All right. Thank you both. Thank you so much. And hope to talk to you soon, and keep up the great work.
Well, thank you very much. We really appreciate it, Brandon. This is an opportunity for, I think, the whole country.
You're welcome, Robin. Take care, you both.
Take care. Bye-bye.